better understand how the laser corrects refractive errors, it helps to understand how the eye works. In order for an image to focus clearly on the retina, the cornea must be of the proper curvature. After entering the cornea, light rays then pass through the pupil and through the natural lens of the eye to come to a point of focus directly on the retina. Nearsightedness occurs when the cornea has too steep of a curve or the eye is too long in relation to its corneal curvature. This causes images to come to a point of focus in front of the retina instead of on it. Nearsighted people can usually see very close objects clearly, but their distance vision is blurry. If the cornea is shaped like a football, more curved in one direction than the other, they have regular astigmatism. Astigmatism causes light rays to bend in such a way as to create no single point of focus, resulting in blurry and often distorted vision. Farsightedness occurs when the cornea is too flat or the eye is too short. This causes light to come to a focus at a hypothetical point somewhere behind the retina. People who are farsighted can experience blurry distance and also blurry near vision. But when a farsighted person is young, their distance vision is usually better than their near vision. This is because the lens inside their eye is able to change its shape, helping to bring their vision into focus. We call this ability accommodation. As we age, whether we are nearsighted, farsighted, or normal-sighted, usually around age 40 to 45, the lens inside the eye begins to gradually lose its ability to change its shape. This causes us to pick up reading glasses to read small print, or we begin wearing bifocals or even trifocals to see well at all distances. This naturally occurring condition is called presbyopia. But if a nearsighted person beyond the age of 40 or 45 were to take off their glasses or contact lenses, their distance vision would be blurry, but they can generally see better up close than they could with their glasses or contacts on. So, when a nearsighted person in the 40 to 45 age range has both of their eyes corrected for clear distance vision with glasses, contact lenses, or in this situation, laser vision correction, they may find themselves needing reading glasses to see clearly up close. If you're approaching or over the age of 40, you may want to discuss having monovision or blended vision with your doctor. This is where one eye is corrected for near vision and the other eye is corrected for distance. Your procedure will be done during a brief outpatient visit. You'll need to arrive about an hour before your scheduled procedure. You'll be given eye drops and possibly a mild sedative. You will remain awake and should be quite comfortable during the procedure through the use of very effective anesthetic eye drops. Your eyelids will be held open to prevent you from blinking. EpiLASIK is different from other forms of advanced surface treatment in that it actually uses a special instrument called an epikeratome to make a hinged epithelial flap. You will be asked to look at a fixating light as the laser reshapes your cornea, often within a minute or so. Advanced surface treatment uses ultraviolet light from an excimer laser to remove tiny amounts of tissue from the cornea with accuracy up to 0.25 microns with each pulse. If treating nearsightedness, tissue is removed from the center of the cornea, moving the point of focus from in front of the retina to on the retina. If treating farsightedness, tissue is removed from the outer margins of the cornea, moving the point of focus from behind the retina to on the retina. If treating regular astigmatism, tissue is removed from the steeper areas of the cornea, creating only one point of focus on the retina. If you have astigmatism along with nearsightedness or farsightedness, the laser will treat both problems at the same time. After treatment, the epithelial flap is folded back over the treated area.